During your time at R2P, you are going to be faced with the situation where you're going to need to figure out, does this patient require or would they benefit from medical imaging? And I think that's the beautiful thing about the state of Maryland and a lot of other states with the PT profession is that we do function as a direct access state, meaning that patients oftentimes, depending on their insurance, do not require a referral to come in for physical therapy. Coming out of school, the first job that I took, we did not see a lot of direct access patients. Oftentimes, the individuals were coming in directly referred from a physician, from an orthopedic, from a neurologist, or maybe they had already gone to urgent care. So just the patient population that we saw, it was rare that we were seeing people in a direct access setting. Here at Rehab to Perform, we see a large number and a high percentage of patients that are direct access. And I think some of that just has to do with our presence within the community and the amount of touch points we have where just people are familiar with who we are and what we do. So when they have a sports injury, we're often top of mind and they want to come in and see us. And whether or not we're actually the first person they should be seeing is left to be determined. And that's really what that first session is all about, making sure that they are appropriate for PT, making sure that we are recognizing things that may fall outside of our four walls in regards to being the best person for them to see and triage the situation and understanding when do we need to tag out, when do we need to refer, or when do we simply just need more information. So we will go into some more depth with the follow-up videos and regarding different scenarios that have more clearly defined either protocols or clinical prediction guidelines in regards to when is it appropriate or when is it required to refer out, when are the odds more in your favor of identifying or not identifying something. But I think we also just need to appreciate that we're going to be put in situations where we are the first point of contact for many patients who will walk into the doors, making sure that we feel comfortable and confident in our ability of when it's appropriate to refer out. And I think as a young clinician, or just if you're not very experienced or have much exposure in this type of setting, it can be a little bit intimidating telling somebody that they need to go get imaging. Maybe you're worried about being wrong. Maybe you're worried about inconveniencing them. Maybe you're just not sure exactly what's going on and you're not sure how to verbalize that to them. And that's fine. And fortunately, you don't work alone at your clinic. You have other clinicians who are there that can help you out. And if you're ever unsure in a scenario, I would highly recommend just take a quick minute, let the patient know that you're going to converse with another PT on staff, pull one of your senior staff members aside or reach out to somebody else in the company and just get their opinion, get their input, because more often than not, it is not going to be the first time that they have encountered it either, and they can share just their experiences with you and really just what the best standard and best way to go about handling that situation is. So don't be afraid to ask for help. Don't be afraid to reach out for guidance from colleagues and people within the company. That's what we're here for. And we're all in it to get the patient the best care and make sure that it's happening in the most efficient and optimal way possible. I think something that we can do, though, is just make sure that we are up to date and familiar with what are the different protocols in place for our common injuries that require medical imaging, and making sure that we're aware of what they are, what the identifying factors are for them, and the best steps and plans of care to go about making the recommendation of when and how to go about imaging. So with this, I think something that we also need to keep in mind is just because somebody is supposed to get imaging for a given condition does not always mean that you cannot do something meaningful that day with them in that session. So there are some conditions where getting imaging and having more information will be beneficial to their overall plan of care, but it is not going to dictate what you accomplish in that session. There are other things where you cannot proceed and you cannot continue with PT intervention until you do get imaging and rule out or get better diagnostics on what type of injury you're dealing with. So Being familiar with the different guidelines, the different pathologies, and just appreciating, is getting imaging going to help with our diagnostics and the formation of plan of care and letting us know what's indicated versus contraindicated? Or is imaging just going to give us a better idea of the prognostics of what's going to happen? And maybe the sequence of events is still going to remain the same regardless of if they get imaging or not, but it may allow us to move better with more confidence and more clarity, and it may be something that allows us to articulate and communicate to the patient with a little bit more certainty what types of timelines and timeframes we're dealing with. Is this a days versus weeks versus months, or a completely unknown scenario in regards to how it is going to progress and what we are looking at for different checkpoints along the way?